Dr. Huffner, thank you for joining us this morning. I appreciate the time. I was wondering if you could give an overall status report on the COVID care, not only at Shore Regional Health hospitals, but emergency departments at this point.
Right now, we are seeing a significant surge in the number of patients in our hospitals and emergency departments. The most number of COVID positive patients are now present in our hospital since we began the pandemic. Unfortunately, our Eastern ED is overwhelmed with patients who need to be admitted to the hospital, and they are having to stay in our EDs oftentimes for protracted periods because of a lack of staff beds. And the waiting times in our EDs are ever increasing because of the pressures seen for on the inpatient side, where again, we're challenged with appropriate staffing resources.
What are the approximate waiting times, and is there any way that we can reduce those numbers?
Sure. The waiting time, of course, does vary depending on the severity of illness that presents. Someone who comes in and acutely ill to any of our EDs is obviously always prioritized over those that have, if you will, less emergent. So we always do triage. But those routine things that can wait will have to wait, and will obviously have to wait even longer because of the bottlenecks in our EDs and the backlog of patients there. Some of the strategies, of course, are making sure that we don't present to the EDs without true emergency needs. We are not offering routine COVID-19 testing in any of our EDs, and recommend that those that wish to get tested, and believe me, we strongly encourage testing, do so outside of our emergency departments. And again, reserve the use of the emergency departments for true emergencies. Again, encouraging our community members to contact their primary care providers and utilize our urgent care facilities. Of course, there are also strategies, particularly at this time, that would be helpful.
Late last week, Governor Hogan issued a state of emergency executive order, and I guess I'd like to understand a little bit more how that impacts Shore Health.
We're very appreciative of the governor's declaration, because it does help us in many ways, trying to bring in additional staff to meet our staffing needs. It includes licensing relaxation for nurses, also for other type of technologists that we utilize within the hospital, as well should we need additional physician resources and APP resources. We're able to, if you will, streamline the process to bring those persons on board. It also allows us to relax some of the documentation burden that is within the hospital. Again, it does help us.
There have been several reports that the Omicron virus is less threatening than the Delta virus, and is causing less severe illness. But if that is true, why are there so many people that are in the hospital these days?
Well, in terms of the presentation, in terms of the illness of patients who present with the Omicron, across the world, we see that the disease severity is less. Unfortunately, at this time, though, because our unvaccinated persons are becoming ill, we're seeing a lot of patients come in who are unvaccinated, and are making up a big majority of those patients who require hospitalization. So Omicron might not create necessarily more severe illness, but it does create, because its infectivity is so much higher, a greater preponderance of people becoming infected. And again, that within that group of persons, anyone who has any other comorbid conditions, of course, does become ill often, and requires hospitalization. People do get sick with Omicron. It's not to suggest that it's an innocuous disease. We know that people do get sick. It's just the severity of illness is generally not as severe as it was with the Delta variant.
Shore Health was administering antibody treatments for COVID positive patients at risk for severe illness. Why are there so many people doing in the hospital for that reason?
Well, again, the monoclonal antibodies, the monoclonal therapies that we have were quite effective in assisting in the care of patients with the Delta variant. They are not effective dealing with the Omicron variant. So that's the big discrepancy. There are new therapies being developed. There is another monoclonal that has been shown to be effective against the Omicron. It has, unfortunately, a great deal of side effects, and there are many restrictions with its use. It's also in very, very short supply, not only in Maryland, but across the nation. The supply is just very, very low.
And what should somebody do if they think they do have COVID?
Well, again, the most important tools in our toolbox continue to include social distancing, wearing masks, hand washing, trying to self-isolate yourself, but also, most importantly, we need to get our population vaccinated. If anyone is unvaccinated, that's the most important message that we need to get into our populations, into our communities. Please get vaccinated, and also please get your booster shot. We know that people who are boosted have a much less chance of getting ill, either with Omicron or any of the variants associated with COVID-19. So immunization is critically important. And obviously the other tactics, hand hygiene, social distancing, mask wearing in public, all are critically important tools to decrease the spread of this disease. On an individual basis, of course, you want to watch yourself. Should you have significant difficulty breathing or have fevers, you need to report that to your primary care provider.
With this kind of stress on a system, I always worry about health providers. Could you give us a sense of what the morale is like and how is the system coping with this unique circumstance?
It is a very difficult situation for our team members. We've been doing this now for the better part of 54 months. There is a desire to be resilient when it comes to this, but it is tiring. The pressures, of course, on our team members becoming vaccinated and then also not being able to participate in care puts increased amount of pressure on our team members to, if you will, step up and do extra above and beyond work that they would normally do. So there is fatigue associated with this, and it is very frustrating to watch community members not recover. Particularly those who are still refusing to become vaccinated. It's very frustrating for healthcare workers to know that we have a tool, the most effective tool in preventing COVID-19 and its spread, and there continues to be significant resistance within our area to getting vaccinated.
Do you think we're at a danger point here?
Well, danger point, yes, in terms of the pressures on the hospital system and our emergency departments and inpatient, because we have so many patients, and we are in a situation where we are very, very close to exceeding our abilities because of scarce resources. And the scarce resource, the number one scarce resource, of course, is our staff members and our team members who need to care for these patients. And I can't tell you how proud everyone is of all our team members stepping up and doing everything that they need to do to care for these patients. But again, there is fatigue associated with this ongoing significant pressure.
Is there any good news that you have been observing that could be shared with the community?
I think the biggest good news is that we have a wonderful team at Shore Health, that we have dedicated physicians, nurses, technicians, providers of all types that have done a wonderful job of stepping up to the plate, and that it is a very, very noble team that continues to work on a day-by-day basis to meet the needs of our community who become ill. I think that's the most important thing to remember. We do believe that this surge will last probably another 6 to 8 weeks, and that we will see, as we've seen an abrupt surge, we hope to see the also rather quick decrease in number of cases that have been seen in other parts of the world, as Omicron has a huge impact on the communities.
Dr. Huffner, thank you so much.
My
Please
pleasure.
stay safe and